It is necessary to suffocate a tick with oil. For many years, it was believed that the best way to remove an attached tick was to suffocate it with oil and then twist it out clockwise or counterclockwise. Do not do this. During suffocation, the tick might regurgitate the contents of its stomach into the wound, which would increase the likelihood of infection transmission. Instead, disinfect the site of attachment and then remove the tick using a special card with notches, or tweezers, making a rocking motion from side to side. Then disinfect the wound again. If the mouth parts remain in the skin, it should not be a problem, as there is no risk of infection transmission from them and the body will handle them as it would a wooden splinter under the skin. The safest way to dispose of a tick is to flush it down the toilet or burn it in a fire. Do not crush it between your fingers. If you want to be sure the tick was not infected, you can place it in a plastic bag and send it to a laboratory for examination. Addiction develops from antidepressants. Antidepressants are modern medications used not only for treating mood disorders, such as depression, but also for addressing long-term anxiety spectrum disorders, psychosomatic disorders, or in the treatment of chronic pain. Their use is associated with the occurrence of side effects. However, addiction to them does not develop, as they do not have addictive potential. Nevertheless, if they are discontinued suddenly, a withdrawal syndrome may occur, which can be prevented by gradually reducing the dosage. Addiction, however, can develop from other medications, the so-called anxiolytics, which are used to suppress unpleasant symptoms of anxiety disorders. Therefore, anxiolytics should not be used long-term. Any unpleasant effects associated with taking antidepressants should be consulted with a doctor, who will adjust the treatment accordingly. Addiction can develop to medications in the same way as to alcohol or drugs, especially to anxiolytics, sedatives, sleeping pills, painkillers, and stimulants. Low cholesterol means a healthy heart. Cholesterol is important for the processing of fats in the body, for the formation of cell membranes and vitamin D. We distinguish between so-called good cholesterol, HDL, which removes all excess cholesterol from the blood vessels to the liver, and so-called bad, LDL cholesterol, which accumulates in the blood vessels and thus reduces their permeability. The total level of cholesterol in the blood should not exceed 5 mmol/L, otherwise the risk of developing cardiovascular diseases increases. However, even a low level of cholesterol in the blood does not guarantee that heart diseases will not develop. There are other risk factors for their development, including smoking, high blood pressure, diabetes, obesity, lack of physical activity, excessive alcohol consumption, and others. The development of heart diseases can be partly prevented by healthy eating and sufficient physical activity. However, some factors such as age, male gender, or genetic predispositions cannot be influenced. Mammogram examination hurts. Mammography is currently the only diagnostic method capable of detecting a tumor in the breast as small as a few millimeters. However, during the examination it is necessary to sufficiently spread the breast tissue, meaning the breasts must be compressed, which can be unpleasant, but for most women it is not painful. Pain may exceptionally occur in women with more sensitive mammary glands, at the time before menstruation, or during hormone replacement therapy. However, if the compression of the breasts is done slowly, possibly with small pauses, it is without any pain. For women up to 40, or possibly 45 years of age, an ultrasound examination is more suitable. Later, due to changes in the structure of the breast, mammography is a better examination method. Incontinence is a matter of older age. The involuntary leakage of urine troubles up to 1/10 of the world's population. Although it occurs much more frequently in people of advanced age, incontinence is not inevitably just a consequence of aging. It quite commonly affects even young women after childbirth or gynecological surgery, and it does not avoid children either. It arises as a result of excessive pressure in the abdomen, such as when coughing, sneezing, lifting heavy objects, or laughing. It can also be the result of a urinary tract infection, injury, surgery, diabetes, or degenerative diseases such as multiple sclerosis. Swallowed chewing gum stays in the body for years. There are many myths surrounding swallowed chewing gum, especially the one that it does not break down in the body, or that it takes several years. In reality, gum lasts in the body for only a few days. In the stomach, the digestible components are absorbed, and the rest travels to the small and large intestines and then exits the body naturally. However, swallowing gum is not something a person should do regularly, because the gum can, for example, stick to the wall of the esophagus and cause complications, or block the intestines. If you accidentally swallow gum, stay calm. According to doctors, there is no major danger. Who works with a computer will need glasses. Many people today spend their working hours in front of a computer screen, or hours staring at their mobile phones. This brings difficulties in the form of fatigue, burning, or an unpleasant stinging sensation in the eyes. It is therefore not surprising that rumors are starting to spread among people that their eyesight will worsen as a result of the long hours spent in front of a monitor. However, nothing like that will happen. The eyes are tired and burning because of insufficient blinking. Normally, we blink about 15 to 20 times per minute, thus moisturizing, cleaning, and regenerating the eyes. However, when working on a computer, we blink much less, only about 6 times per minute. That is why the eyes are tired, but it will not bring us more diopters. As a first aid for eye fatigue, artificial tears can help. Also, try to adjust your working environment so that your monitor is not in front of a window and direct sunlight does not fall on it. Alternate looking at the computer with looking into the distance, for example out of the window. Varicose veins are just a cosmetic problem. Varicose veins, or varices, mean enlarged superficial veins of the lower limbs. Their formation indicates an overload of the venous system of the lower limbs due to obesity, lack of physical activity, and other risk factors. Untreated varicose veins can lead to the development of leg ulcers, meaning the varicose veins open to the surface of the skin. Alternatively, thrombosis can develop, which can cause a pulmonary embolism, threatening a person's life. To reduce the risk of developing varicose veins, it is necessary to engage, ideally every day, in physical activity, to regularly relax with legs in an elevated position, and to avoid prolonged sitting and standing. Pollen allergies only appear in the spring. Allergies to plant pollen, that is, an inappropriate reaction of our immune system to wind-borne pollen grains, manifest as watery runny nose, sneezing, a feeling of a blocked nose, red or watery eyes, and breathing difficulties. Most people associate them with the spring season, when most plants begin to bloom. However, be careful, a hazel tree needs only a few degrees above freezing to start blooming. Its pollen can thus start appearing in the air as early as February, and in case of a warm winter, even earlier. That means at a time when allergy sufferers are not expecting it at all and therefore attribute the symptoms to a cold or a viral infection. Try taking allergy medication first even during winter if you have a runny nose and burning eyes. You may find that you won't need any other medicine. A heart attack begins with chest pain. In a myocardial infarction, also known as a heart attack, there is a sudden interruption of blood supply to a part of the heart. In most cases, especially in men, who are affected by heart attacks more often than women, it really manifests as sharp chest pain. However, there are many patients with much more subtle symptoms of the course of a heart event. These include frequent shortness of breath, when the affected person is unable to finish a sentence, excessive sweating, back pain, poor sleep, great fatigue and general weakness, or nausea. The best way to prevent a heart attack is through regular medical checkups and maintaining a healthy lifestyle, as well as regular physical activity and avoiding mental and physical overexertion of the body.